In the middle of a cost of living crisis, Kate Mason says she had no choice but to pack up her house and find a cheaper rental to afford the growing cost of her son's therapy. It comes after the federal government cut the number of subsidised psychology sessions from 20 to 10.
There's been so many little things that have had to change to make sure he could be treated.
The added expense meant his weekly sessions had to become fortnightly, prolonging his recovery.
If your child had a broken leg, it would be covered by Medicare. If your child's assaulted and has PTSD, you don't have that money. Medicare doesn't even come close to treating them.
The cuts came into effect on January 1st last year. They were made against the advice of an independent report handed to the government. It found while the sessions disproportionately favour people on relatively high incomes in major cities, the additional 10 sessions should continue to be made available and should be targeted towards those with complex mental health needs.
Yeah.
The government said the decision would allow more new clients to access the scheme, and data shows more than 43,000 have. But many say it's come at a cost.
I feel like there's been a big impact on our clients. So we've seen that our clients aren't able really to have their full treatment.
It impacted 240,000 Australians who are currently accessing the additional 10 sessions.
Labor backbencher Josh Burns says he remains concerned about those who need more involved treatment.
For people to be forced to pay hundreds of dollars to access mental health care, well, that can be a barrier, and that will mean that people are choosing not to access mental health care.
In so many cases, like my son, he was too sick for headspace, but he wasn't sick enough to be put in hospital.
The Albanese government promised major reform to the mental health system to make it more accessible. After a year of consulting, more money has been announced for crisis services like Lifeline and Beyond Blue, but it's still not clear what support will be offered for those that need longer-term care. Krishani Danji, ABC News, Canberra.